Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of the NAAOP. Just got back from the Academy meeting, and there's been a lot of chatter, a lot of talk about BIPA 427. For those who may not know, the Benefits Improvement and Protection Act of 2000, that's 17 years ago, passed and included some provisions specific to orthotics and prosthetics. The law basically said that no payment shall be made by Medicare for custom orthotics or all prosthetic limbs that are not provided by a qualified practitioner and a qualified supplier. So it's a payment bar to any individual or provider or supplier that basically submits a claim to Medicare for custom orthotics and prosthetics without appropriate qualifications. And the qualifications were laid out in the statute. This is a regulation that is yet to be issued, but we finally, as you probably well know, saw the issuance of the proposed regulation on January 12th of this year. Comments are due on the 13th of March, and NAAOP, along with all of the Alliance organizations, have been working very hard to try to get a comment letter together and to gain consensus around what our comments will be. You should also know that we've heard from a lot of other groups, other professional organizations, other individual hospitals, physician groups, PTOT organizations, and the like, all asking our comments, asking about our interpretation of the rule to try to see what we plan on saying. There is a fair amount of concern by professionals across the country who feel that this proposed rule may very well prevent them from doing what they currently do. There are, in fact, some providers or some professionals, I should say, that provide custom orthosis, not really prostheses. I think that's really largely, this issue is confined to orthotics. But there are some that provide custom fabricated orthotics in the course of their practice. Some examples, hand therapists who work with hand surgeons typically will provide custom fabricated orthoses. In fact, there's a separate credential, a certification for hand therapists. Some physical therapists will provide custom foot or ankle or knee orthoses in the course of their practice. Some physicians may do the same. There are a number of ways to deal with this issue, and BIPA 427 was really never intended to prevent access, patient care access to services that are needed, especially in rural areas, by professionals who are qualified to provide healthcare services in their scope of practice. It is intended to limit those who really have no education and training in orthotics and prosthetics from billing the program. So the NAAOP, and as a member of the Alliance, is trying to strike a balance and trying to make sure that in the end we get a final published regulation that meets the needs of Medicare beneficiaries and, frankly, in the providers who serve them. The main goals of this regulation and this legislation originally were to protect patients from unqualified providers and suppliers, and to protect the integrity of the Medicare program, to ensure that waste, fraud, and abuse did not invade the O&P benefit. And so it's critical that we get a final rule through. And consider what we're up against. The rule was issued under the prior administration. There is a new administration that has a very strong commitment to reducing regulation and to ultimately lifting burdens off of businesses and in the healthcare area, healthcare providers, to comply with fewer regulations. So we're up, we've got a pretty stiff headwind to get this final regulation issued in the form that will make most sense for the healthcare field and for the patients who rely on it. So we're working hard to make sure we can gain consensus around these issues and to make accommodations where necessary and still hold true to our principles that custom orthotic and prosthetic care requires qualified practitioners and suppliers. We look forward to issuing our final comments and getting them out in the next 7 to 10 days, and we look forward to continuing this debate with the O&P field to try to move this entire practice and this entire field forward. Thanks so much.